Hi, my name is Jacek Szepietowski. I'm a full professor and the chair of the Department of Dermatology, Venereology, and Allergology of Wrocław Medical University. Currently, I'm serving as the president of the Polish Dermatological Society. I've been involved for many years in the studies on psychodermatology, itch, that means pruritus, and inflammatory skin diseases, including atopic dermatitis, psoriasis, and especially hidradenitis suppurativa. Oh, I'm enjoying the WCD very, very much. I had the pleasure to deliver 3 lectures, and I would like to pay your attention to the acne and psychodermatology. I think that the acne is the most common disease within the dermatology. A lot of young adults and adolescents, they suffer from the acne of different severity. But one can say that 15% of those subjects are suffering from the severe acne. And definitely, acne has an influence on a patient's psyche. I did an overview on psychodermatological aspects of acne, and I also presented the own data of our group. We studied the stigmatization in acne patients, and we clearly demonstrated that the patients with acne, even with another severe acne, they are highly stigmatized. That means there's an influence on a patient's well-being. There is also the correlation between the stigmatization and the lower quality of life. We also looked at alexithymia. That means the difficulty in identifying and verbalizing the emotions. Those patients are characterized with external-oriented thinking. And although we were not able to find a difference between the acne and non-acne group concerning the alexithymia, there was difficulty, and we found a relationship between the alexithymia and the stigmatization and the quality of life. I also just overviewed the study which was performed based on the ESDAP first study. That means the study carried out by the European Society for Dermatology and Psychiatry, and that was clear that the patients with acne are at a higher risk of the developing of depression, anxiety, and also there is a risk for the suicidal ideation. I'm thinking about the suicidal attempts, but mainly the suicidal thoughts. All of those can underline that the acne is definitely not a cosmetic problem. It cannot be treated as a cosmetic issue. Definitely, that's a serious cutaneous condition, and the acne requires a holistic approach to the patient, including also the psychological, at least consulting. Psychodermatology is a rather new branch of dermatology. That's a borderline between dermatology, psychology, and psychiatry. It's also very important in the aesthetic medicine. I think that the skin lesions, they are visible to others, and definitely the majority of skin problems are not life-threatening ones, but they influence heavily the patient's psyche. Therefore, I would like strongly to recommend you to work closely with our colleagues from the psychology just to help our patients with their skin problems. Keep in mind that the skin diseases are usually chronic, they are recurrent, and they are long-lasting ones. It's important that the patient at least can cope with the disease correctly, and that will be a help in the holistic approach to those kind of patients. Psychodermatology requires the training. And of course, I think that we do not pretend as dermatologists to be psychiatrists, but we would like to be well-informed dermatologists. We need to know how to identify psychodermatological problems, how to deal with patients with psychiatric disturbances. It's clear that some patients cannot be referred to the psychiatrist, and therefore we must take responsibility of those patients. For example, the European Society for Dermatology and Psychiatry organizes the European Psychoderm Diploma. I think that at least the first stage of this diploma is useful for all colleagues, both the residents and also the consultants in dermatology. We need to know even how to apply the psychotherapy in psychodermatology. Of course, it's not possible to know all the drugs. However, I will recommend you to know at least 1, 2 drugs from one group. It's important to know the mechanism of action, the application way, and also the adverse events of these subjects. Anyway, if there is a chance, please collaborate with your psychologist and also the psychiatrist. However, at least in some patients, for example, those suffering from delusional infestation, it's almost impossible to refer them to psychiatrists. Therefore, we should take the responsibility of the treatment algorithm and the treatment management for those subjects. Therefore, our basic knowledge on psychodermatology is very important.